Hi, my name is Jenna Reed. I'm a graduate assistant at the University of Utah. And when I first heard about COVID, I was actually a master's student at Georgetown University. And I was in a class called Emerging and Reemerging Infectious Diseases. And one of our weekly homework assignments was to gather news stories about emerging and reemerging infectious diseases around the world. So it was actually on our radar quite early in this class because we were on it since kind of the winter when it was just an unknown coronavirus in China, and had been following it the whole time. My classes completely shut down, and my university pretty early on announced that we weren't resuming by the end of the semester. And it was my last semester of my master's when COVID started, and I knew that I was coming to the University of Utah afterwards. So about 2 weeks after lockdown, I actually decided to move from DC to Utah because I didn't want to get stuck somewhere where my program wasn't, and then we had to start remotely. So it was a little difficult trying to start a new graduate program completely virtually. I think the university, though, did a really good job trying to keep us connected. We had a combination of virtual and in-person with safety measures. So it was actually more in person than I thought it was going to be. I was worried that the entire thing would be virtual and I'd have to do all my lab rotations virtually. And I was really thankful that that wasn't the case. So it was a bit of a learning curve because sometimes training opportunities were hard to come by, but overall I think the university handled it well. I wouldn't say the pandemic changed my career trajectory, but perhaps emphasized it more. I had known that I wanted to go into an infectious disease related field for a while, and I should think that the pandemic emphasized that we really need people in those fields. Another thing that I was also very passionate about, that I think I've become even more so since the pandemic, is science communication and the need to spread the knowledge that we're building as scientists to the public. I think in the pandemic we saw a lot of misunderstanding and misinformation. And so I think seeing all that in the pandemic emphasized the need to me more to go into that. I think I was surprised just at how much people were still able to come together. I know that there were lots of different people who had different levels of comfort in terms of how much in-person activity they wanted to do or what kinds of measures they were taking in their personal life. But I think people really managed to work together well in trying to make accommodations for each other and trying to be really considerate of including everyone, but at the same time being considerate of what everyone was comfortable with. The pandemic has emphasized that immunology is really important and that it's the right field to go into. I think, if anything, I have job security in the future. I think in terms of the field of immunology, I was really impressed with how the global immunology community was able to come together and really rapidly respond to something that was new, but we had a lot of previous knowledge that we were able to build on in order to work and refine our response. And so I think this has really been a game changer for how we're going to explore infectious diseases and respond to future epidemics.